Welcome. I am so honored. I am so excited to welcome Dr. Anish Musa. I'm speaking with someone today who is quietly reshaping how preventative and metabolic health is practiced in India and much beyond that. Actually, we'll be talking about some of his initiatives going on right now. Dr. Anish Musa is a physician, lifestyle medicine practitioner, and founder of Vita One, a platform dedicated to simple, evidence based, sustainable care. And what I really admire about his work is how seamlessly he bridges conventional medicine with root cause, lifestyle driven healing. And that's actually how we connected several years ago. His approach is grounded, practical, and deeply aligned with helping people reconnect with their bodies. And again, that's where our philosophies match. And through Vita One, he supports individuals with metabolic issues, gut challenges, inflammation, and lifestyle change. That is all that is required when we are dealing with all kinds of chronic health issues. But there are many other things that we will talk about today, some other initiatives that he's working on currently, his vision about the future of functional medicine in India and beyond that. So once again, welcome, Dr. Anish. So happy to have you here today.
Yes, thank you very much, Anandita. And I can say we had started the awareness of functional medicine in India. And I can recall, I think 9 years, 10 years back, we had a discussion and we had a very first, I think I can say a very first foundational functional medicine workshop that we had done in Ahmedabad, where, we had aware the people about the functional medicine. And at that time, nobody knew about the word functional medicine. And from where, we had started creating awareness about the root cause medicine, functional medicine. And now I'm seeing from that point in India, we functional medicine has grown up like, it's coming out of something and then, it's growing in India. So yeah, thank you very much for inviting me in your podcast. And yeah, happy to discuss with you. And always, I feel love and honor to be with you.
Thank you so much for sharing that. Yes, we did start that. And I remember that workshop in Ahmedabad very well. I don't think people had a clue about functional medicine or health coaching at that time. So either of, but you're right, we have come a long way, but we still have a long way to go. But it's always good to look back and appreciate how much, the progress that we have made. But let's start at the beginning. And if you want to like to share how you got started, what is your sort of story of getting into functional medicine in the first place? Because you were in the conventional medicine practice to begin with. Now you're blending, but how did you start there?
Yeah, so my story is I had started I was, by the way, ophthalmic surgeon, and I'm doing ophthalmic surgery practice. So I may pass my surgeries in 2005, and from that onward, I was a happy ophthalmologist. I'm doing my surgery, and I love my surgeries because I born to be a surgeon. What I entered in a medical school, but later on, I started having some kind of IBS. And then I got a muscular pain, IBS, and there is no clue. I done a multiple time endoscopy and colonoscopy, and IBS. They say that this is a functional disorder. So in short, I don't find out solution in conventional medicine. And then finally, passing through all these symptoms again and again, conventional medicine failed me, and they diagnosed me as a depression. So they want to put me on antidepressant. And that point, I asked myself, is it really me who get depressed? And that question has gone deeper, deeper in my heart. And from that, I started looking at what is going on. And then, at that time, I started the internet, and I found very interesting guy, Dr. Jerry Tennant, and he brought me in a functional medicine, what I say. And then I was connected with him because he's also ophthalmologist, and he passed through a different story, but he was coming from the same conventional ophthalmic background, what I had learned. And then he was turned to be a electromedicine physician. Then he had done a lot of research, and I was passionate about his work. And one day I got his email, and that says me that now functional medicine is accepting microcurrent or electromedicine. That email strike in my mind, oh, what is this functional medicine is? And that is that is turning point. Then I searched the functional medicine and end up with IFM. And that's how my journey started, and looking at deeper what's going on, what's thing we can think beyond conventional ophthalmology or conventional practice.
No, and we will talk a bit about what you believe is the future of functional medicine, especially in India, and how we can scale, because I think that's where we need to be. When we started so many years back, I think about almost 9, 10 years back, it was a different thing because we were all trying to figure out what this is. And it's so interesting because you share your story, I share my story of trying to help my daughter, because so many of us come from a background where conventional medicine helped us, but it failed us. It's not to say conventional medicine of course doesn't work, but it doesn't work when in the case of chronic conditions like we are talking about. That's where the problem lies, because it doesn't really address the root causes, because as you said, you were going to be given medicine for depression. I mean, it was not depression, it was root cause was your gut health. Same with my daughter. She was put on one medication after another for eczema, but nobody was addressing the gut health. So she was, so it's really interesting, and I'm really glad. Not, I would not say glad. None of us would like to be in a position like that, but I'm glad that we, so many of us have found a way out of this, and now we are shining a light for others to, sort of also come through. Right? It's so hard to be stuck, and we all know that. So tell me now, focusing a bit on functional medicine and India in particular, because I know that you're doing a lot of work in that area. So, what convinced you that functional medicine can scale, and how it should scale and should scale in India, or could scale in India?
Yeah, so no, I will share the story again. So after that, when I gone to the IFM and I searched the IFM, I find out they are doing a conference in China. This is about in 2016. I got the information from them, and then I decided to go in China to what's going on in functional medicine. That is the first time I go to China. That time, I'd seen that the doctor who is running the conference in China, he's Dr. Ho, and he's a pathologist in USA. So he left the USA and he came in China. And then before I came there, since 5 years, he is spreading functional medicine in China. And
Oh,
that blew my mind. So
2016, so many
2016. So
years.
he maybe started in 2012, 13, I don't know. But he told me that 5 years they are running a all functional medicine awareness practices, and they're teaching functional medicine over there. IFM is coming from the USA to the China and teaching the functional medicine. And look at the crowd. In the entire hall, there are 300 Chinese practitioner doctors. And look at the energy, because the speakers are from USA and they don't know Chinese. Same way the crowd is Chinese, they don't know English. And
Wow.
although you can see the energy and how they are exchanging, how they are interested, so I thought, why these people are interested in functional medicine? And that, after coming from the China, I just have one idea, let's do something in a functional medicine. Let's build a functional medicine ecosystem in India. And from that onward, I'm just trying to build an ecosystem around the functional medicine, how we can make the functional medicine work in India. So how we can do nutrition, how we can train the coaching. And then slowly this ecosystem has started building in India. So yes, of course, if you look at even the conventional medicine, then I look at the conventional medicine from the different point of view. I consider conventional medicine is a one lens from where we see the patient, right? And then there is a hammer, right? How we can use a tool. So I'm looking at what base tool conventional medicine is used for acute condition.
Yes.
Yeah, that's a very, very helpful tool. And for diagnostic, yeah, we can diagnose the deeper inflammation, we can diagnose the gut health, so many things we can do. So that tool is very important. But when
Mm,
it comes to the chronic condition, we only have a symptomatic treatment with that,
mm,
right? And that's important. So I say we start from the good medicine, and then we look at deeper and find out what is the root cause, why the symptoms occurred in the first place, where we can apply the other pathies and the therapies and functional medicine. So I often say is the functional medicine is not an alternate science. It's a very foundation science where you can apply from whatever the background knowledge you have, you can apply this one, right? But if you learn the principle of functional medicine, then you can apply all the different knowledge and science and all these things you can apply. So it is not just an one medicine, one supplement. It's basically, I can say, it's a operating system. It's a thinking process. how we can think for the chronic conditions, and that will change your mind, and that will change. So coming to your point that functional medicine is a future for chronic health condition. So in future, it will be a foundational operating system where we're going to connect the dots of allopathic, Ayurvedic, even we can collect the other therapies and mind-body medicines and healing and emotional healing and coaching, everything come in that platform. So functional medicine, we have to think in a bigger way. It's not just an alternate science.
I think that's a very important point you're making when you're saying that it's not alternate science. I mean, we tend to think of it, I mean, a lot of people tend to think of it as even Ayurveda or homeopathy or anything else as an alternative medicine. But as you said, it's a thinking, it's actually, we call it the systems biology approach. It's a different way of thinking. It's a paradigm shift, actually. Basically, that's what it is. And what you said is so true that it can bring people from all different modalities. That's the beauty of this because it's a way of thinking, it's a different paradigm, and it beautifully also complements conventional medicine where it needs to. See, that's the thing. A lot of people, I think, get stuck. I mean, you can share your view, is in either or thinking approach. You know, that it either has to be this, either I should go in for, medication, treatments, etc., or I can do these other things. I believe that a lot of times you need both. I mean, you need the diagnosis, you need the interventions, you need the medications to, manage some of the symptoms. At the same time, you need to figure out what's going on, what is at the root, address that, what is your emotional health. What have you seen? I mean, have you noticed this
Yeah,
break?
yeah. So I have experience with that. My mother actually diagnosed with Alzheimer, and she was a case where Alzheimer disease is very rare. I was in a second MBBS, and she was diagnosed with Alzheimer, and that Alzheimer was very early onset Alzheimer, and that is very, very, very rare. Nobody know about the Alzheimer.
Yeah.
So after she diagnosed Alzheimer, we gone the conventional medicine approach, and of course we have to go on there. And as they don't have a treatment, even right now they don't have a treatment, and before 20 years they don't have any treatment over there. So me and my father bring my mother to conventional medicine doctor, neurophysician. Then we go to the Ayurvedic doctor, we go to homeopathic doctor, whatever
Yeah.
the available therapies we have. But that was frustrating, when I go to the Ayurvedic doctor, they say stop the allopathy medicine and this is going to work. And we say that nothing is working. They say, oh, because you are taking allopathy medicine, that's why the Ayurvedic medicine not working. I go to homeopathy medicine doctor, then they say, oh, stop everything and then focus on my therapies. So at that time, something came in my mind. Why I'm going for each and every therapy? Why don't should be having a one common science they can address these kind of chronic conditions. Ultimately, dealing with an Alzheimer in the family is a very, very heartbreaking. It's very frustrating. At that time, we have passed a lot of pain, but that things, click in my mind. I think that is a connection I'm carrying, and why when I learned the functional medicine, I immediately jump on. Okay, this will give the answer to that my particular
Yes.
thoughts and problem. And right now, I'm seeing from last 2, 3, last 5 years, I'm seeing a patients, and same thing is happening with this kind of patients. They come, they go to the different therapies, and they don't have any kind of connections, and they're frustrated. They don't know what to do.
It's
So
very,
that's very painful if you look at from patient's point of view. So I started taking a mission like let's make a one medicine. That's
mm,
integrative medicine, where we can use everything. Why should we limit ourselves and living in a only one science or other science? Why don't we come out of and think out of box and make a one operating system? Now, everything is important. We
yes.
cannot say. So if you look at the Ayurveda, we have a years and years of experience, right?
Thousands of years.
Thousands of years of experience we have, and that knowledge we are collected with experience, and in a conventional medicine also we say trial and error. So
Yeah.
already we have a whole knowledge, plethora of knowledge over there. Just we have to combine the science over there, and let's do. So
Yeah.
the problem what I'm seeing with my experience is every pathy has their own ego, and they don't start to expand, start to accept others knowledge, other things. But we have to break this, we have to think out of box and how we can combine this, how we can find out a solution. Ultimately, as a practitioner, as you said that, we are here to help people. So that we have to let us explore. That have to be a open dialogue discussion, how we can work on this one.
And I think that what we are discussing today and what I'm discussing with some other practitioners, hopefully this will be that dialogue that is so important. And I'm so sorry to hear about your mother, but I mean, I do know how painful it is, not only for the patient, but for the entire family going through pillar to post to find those answers. And you said, once somebody says this is the right thing, somebody else says that is the right. In fact, one of my clients said a very interesting thing. I'm not from a medical background, as you know. I am trained as a coach, and then I also have some functional medicine clinical knowledge. But at the end of the day, I don't diagnose, I don't prescribe medication treatment, but I do a very important thing. And I don't think I appreciated how important is the work that I do. I mean, for that day, you have these moments that something happens, somebody tells you something, turning point. So for me, that was my turning point. This was I think about a year and a half ago. I was working with this client for a while. I think I was already working with her for more than 6 months. She was seeing, and she's still seeing, because she has multiple health issues, very, very complicated. She's had cancer in the past. She's under watch for another type of cancer right now. When you've been through chemo and the treatment, there's always that thing of it coming back in another form. So anyway, so she's with that. Then she has multiple autoimmune conditions in multiple organs. So she sees doctors. So it's a lot. And I have helped her to a large extent, on the basics, the nervous system, the coaching. That coaching works beautifully in changing the way we think about food, in relationship with her body, with food, etc. But I still don't think I appreciate it till she told me one day, because she was seeing six doctors, about five or six specialists she sees, okay, and a therapist, because she was also going through math. So I told her that, as a coach, I'm not your therapist, but you can see a therapist. What she told me is, Anindita, you are the only person. I go to six people, including a therapist, and they all helping me in different ways. They're giving me medication because there's a lot going on, and some of them she needs medication. You're the only person who sees me as a person, who puts it all together. You are in my corner. I know that when I come to your session, you will hear me out, you will listen to me, and you will allow me to be myself. You're looking at me as a person, not as a disease, not as a diagnosis, not as something to be solved, to be fixed. And that was the day, because till then I was thinking, okay, she's already going to six specialists, how much more can I give her? Because I can't really change her medications or anything, right? But that was my
Yeah.
turning point. So I was like, okay.
Yeah, that's
So, but
that's just what we are seeing. That's also, 2 days back, one doctor came over here, and he was by the way ophthalmologist. He's working nearby here. So we are just discussing about ophthalmology disease and what functional medicine can help in ophthalmology. So I told when I learned the ophthalmologic disease, certain disease like if you know about the glaucoma or iridocyclitis or uveitis, so we used to consider that as a localized eye disorder. That is
yeah,
what in conventional science we had learned that one. So I told him after learning of functional medicine, I don't consider these chronic conditions are a localized disease. They are a systemic disorder. We have to change and we have to change the classification. And we cannot say it just what you are seeing in eyes is not just
yes,
occurred in
yes,
eyes, stayed in eyes. Is because something is happening in somewhere else.
yes,
So that's why we have to explore expand our horizon and we can see. But you are right because conventional medicine we are trained in such a different way, and that's why we are not looking at whole body picture. We are just looking at the isolated picture. So if you go to the cardiologist, they only look at the heart. If you go to the gastroenterologist, they look at the heart. That is important from the
yes,
acute point of view.
yes,
It's very important
yes,
because your focus is very narrow and you want to target that
yes,
tissues or that organ. It's absolutely fine,
yes.
but that bird eye view is not sufficient in case of chronic conditions that we know and what we learn in functional medicine.
And actually, that's what we're focusing on, because there is
Yeah.
a lot of research already done in the acute condition space, the emergency care. And I think that's brilliant and that's so needed. I mean, antibiotics are needed to save millions of lives, but we also need this. And that's why we are discussing this today, actually. So, if we were to name two top barriers to adoption, say, of functional medicine or this way of thinking, where we are integrating all kinds of modalities, what do you think they are? I mean, I know things are changing, and how do we solve them in a practical manner? What are the barriers that you see or you are seeing yourself?
So yeah, so no, I can say my experience with my practice in functional medicine. I started 10 years before, and slowly, I thought, maybe conventional doctor or they will oppose the idea about functional medicine, lifestyle medicine, nutrition. They're going to oppose the idea. But something strange happened. Actually, they are sending their families to me. And then I was surprised, because they know in my town I'm ophthalmologist, but I'm doing a weight loss, I'm doing some autoimmune condition, I'm expert in thyroid. So they are sending the patient and the families to me. So I thought, deeper down, even if in a conventional medicine, deeper down, we know that there is limitations of conventional medicine. Of course, that is there, very important. But we know from deep heart that patient is suffering, patient is coming back. So many of doctors right now, they are interested in functional medicine,
Mm.
going beyond helping, beyond the symptomatic management. They want to also learn the nutrition. They want to also learn the coaching. They want to also learn the different modalities in functional medicine. So yeah, yes, you are right. There is a barrier in adoption of functional medicine, but that is happening with any new technology when they are coming. So the barrier is because they don't have a knowledge and education how to operate this functional medicine in clinical setting. Because if you look at all the conventions, even if you look at the rest of Ayurvedic and allopathy and all these therapies, so there is a typical mindset like, within a 10, 15 minutes, we have to see the patients and we have to prescribe the medicine. See, Neil, look at I can say myself, I will not say about others, but when I was a conventional ophthalmologist, what is my mind? How I'm thinking? When the patients come, my quicker job is to look at the patient's eye. I don't look at right and left. I just look at with the microscope, I look at the patient's eye, and my job is to diagnose the cataract and rest of pathology, what I can see in ophthalmology. And then my mind starts quickly. Can I fix with medicine? If answer is yes, then I prescribe the medicine. If the answer is no, I offer surgeries
Mm. Mm. Yeah.
or a procedure.
Yes.
That is the things, because we want to see a lot of patients and we don't have this much time to look at this one, and we are trained in this one. Just fix it. And of course surgery can fix so many things, but chronic conditions we cannot do this one. So that is a mindset of conventional thinking. So if we can educate them, if we can aware the physicians, they are ready to accept the new technology or new ecosystem. And from the Vita One education, of course, last 2 years we had trained 2,000 practitioners in a functional medicine educations. So I think there is a barrier to adopt this new modality, or we can say a new operating system. But eventually, the world is moving, so you have to adapt. So if you want to work in a chronic segment, then of course you have to upgrade your knowledge and practice in a functional medicine. Another barrier, if you talk about the barrier, then in a functional medicine, we take a lot of time with the patient. It's not easy. Let's say you share the story of that patient. You must be given your time, your emotions, your personal space to them. And it is not for everybody can do this.
Yeah.
A lot of
Absolutely.
time.
Yes.
And even if you look at the conventional medicine, so before 10 years, I need to take on 2 or 3 hours with the one patient to just look at the system dysfunction and root cause, versus I'm just taking a 10 minutes for the surgery and I'm getting the even
Yeah.
more
Yeah.
money in a conventional surgeries. So people around my family say, why are you wasting your time in doing a functional medicine? Just focus on a surgery and you can get a lot of things without any mental stress. The patient is gone, everything is done. So, but I was passionate. This is what something, but what I'm observing from last 2 or 3 years, that technology and AI that can reduce this space, reduce the time of doctors to collect the information and look at the root cause in different ways. So I think when technology come and AI come, that will reduce the barrier between adoption of the functional medicine.
No, so very important, because as you said, correct. I mean, as you said, that anybody who's coming into these kind of professions, whether it's coaching, whether it's functional, all kinds of medicine, it doesn't really matter. They are here because they want to help
Yeah.
people get well. Nobody is coming, otherwise. And but the system is such that, as you said, I can give time because my practice is designed in that manner. Coaching is designed, but not but a conventional practice is not. So that's the huge barrier. And I think the other point that you were making is true. And I think we are trying to sort of bridge that gap. Vita One certainly is. And I think we are having other training modules also on functional medicine and health coaching to help bridge that gap, to bring about that awareness that you were talking about for practitioners as well as non-medical professionals who want to become coaches or at least using the functional medicine paradigm. So that's shifting. That's why I think you said last few years, but I think we can both see that shifting now, and I think the pace is picking up now, which was very slow.
Yes, yeah, yeah. It's
Till
very
a few
slow,
years
but
back,
it's
it
a
was very slow.
yeah. And
But
what
I
I
think,
learned from my experience is, in conventional chronic condition care, one person cannot help, one practitioner cannot help. It's a teamwork basically. So if I'm a doctor and I want to help a patient, I cannot do alone because when we talk, it's a lifestyle disorder, dysfunction. Sometimes patient have emotional dysfunction. Sometimes they have a vagus nerve. We have to work on a vagus nerve. We have to work on a rest of things. So I think it's a teamwork, not just an doctor's job or practitioner job or coach's job or nutritionist job. It's basically at the end of the day teamwork. So if we can have a good team and good environment, then we can heal the patients. And of course, the functional medicine is going very, very pace, and it's now coming. So I can see now functional medicine is a new word. So initially, no, we have to when we are doing a conference in Ahmedabad, we have to say, everybody asking what is functional medicine. Now people are coming, they already know the functional medicine,
yes,
and
yes.
then they are coming now. They are a functional medicine expert or functional medicine practitioner or coaches. They're coming to us like this way. So I'm feeling very glad and honored for that.
Yeah, so things have changed. No, as I said, the
Thing
things have
has
been
changed. Thing
picked
has
up.
changed.
And you're right again that we cannot do this by ourselves. At all, it needs a team, and I think you're building one, and we'll talk about that. But where do you see coaches also fitting in inside the functional medicine clinic, or as one of the the members of the team that you were talking about? And if you have any personal experience that you want to share, I mean, we have worked together on at a workshop or a couple of places, but anything that you would like to share, because that is sometimes the missing piece as well. Like one thing that goes missing, wherein bridging the gap between what the client actually, the example. Let me put it this way: the example that I share is, most people know what they need to do, or if they don't, they can go to somebody who tells them. So we can give them, even in functional medicine. In the case of functional medicine, the example I give because it works, it's very drastic example, extreme example is I tell somebody that what that the cigarette packets, and you have those pictures in front of the packets. Like if fear was enough as a motivator, or like telling somebody that you're going to get this disease was enough, people would have stopped smoking. I mean, just that picture would have been enough. It is not, right? I mean, that's one very extreme example, but it's a very real example. But people still don't change. They still don't change their habits. They still. So do you have any thoughts that you could share how health
Yeah,
coaches
yeah, I will share. Now, if you look at the my study in conventional medicine, when I learned conventional medicine, you know, so when we talk about the conventional medicine, functional medicine, the conventional medicine point of view, what is? Oh, we have to be a good lifestyle. We have to eat a good food. We have to use exercise. We have to do movement. We have to do a sleep, and we don't do a stress. It is mentioned everywhere. It is mentioned everywhere. But
Yeah.
still, people are getting a lifestyle disorder.
Yes.
So what I learn in my experience is we should be having some practitioner who can walk with that patient in that journey. They are missing that part.
Mm.
Just giving a advice is not going to work in that. They need somebody who can really solve their problem beyond their vision, beyond their thinking, beyond that behavior. So
Mm.
that's the behavior changes is what is very important, and that's an entirely different skill. If
Mm.
you advise somebody, they will not change the behavior. Like as you said, if you say that don't smoke, when you go to the doctor's cabin, they always say don't smoke
Yes.
and don't alcohol and everything.
Exercise more.
But yeah, but what I observe is when you say no, they will start more. That is start more.
Yeah.
So I think that is very important, where coach is very important in life studies. So see, let's say what is right now in India or even a globe, which is the most common disease? It's a lifestyle disorder. When we talk about lifestyle disorder, who is a primary in charge of this lifestyle disorder? Is doctor who is taking care of lifestyle disorder? No, doctor is not a primary caregiver for lifestyle disorder.
The patient.
Primary caregiver is coaches and
Ah,
nutritionists.
or
That's
the
the primary
caregiver.
caretaker.
Yeah, caregiver. Yeah.
So I think for lifestyle disorder, patient
Mm,
has to go in them first.
mm,
And then, so we told them, correct lifestyle. Then what is the missing? Come to me and I can fix that.
mm, mm. Yeah.
So, so that's a very important thing, and that's why we need I can say, a huge army of coaches and nutritionists who can help to balance this metabolic lifestyle disorder at the end of the day,
Mm.
right? So as a doctor, we can prescribe, but as a coach and supporting system, that really things should be happening in patient's life, where this coaches and nutritionists and all these are important.
So I think what you're doing with Vita One, because I'm a part of the faculty myself for the coaching piece, and I love doing that coaching. I never knew that I would love to teach coaching. I know I'm a good coach, but that was quite exciting. So you can share some of, I mean, I would love for you to share some of what Vita One is doing to bridge this gap that we were just talking about. The other point before that, I would just wanted to mention, and we'll talk a bit about that as well, is the AI piece, because I think that's an upcoming piece going forward to bridge this need. There's going to be there's a huge demand, but there's not enough people right now, and there are ways that we can harness the power of AI. So maybe we can talk about that, but let's start at Vita One. I mean, what else are you doing? I mean, I know that you're working on a couple of projects, so if you would like to share something how that is bridging the gap.
Yeah, so I told you my passion is to bring an ecosystem for the functional medicine around practitioner. So we had started the Vita One 7 8 years back, where we are working on nutrition, and we are doing a Vita One education where we have a functional medicine clinical nutrition course, and that course is entirely for the coaches, nutritionists, and doctors who can have a foundational science behind the functional medicine. And this course is designed in such a way that you have either you coming from the conventional medicine background or allopathic background or Ayurvedic or coaches or nutritionists. So we are designing this functional medicine foundation course in such a way that you can understand the functional medicine in better way and your knowledge of nutrition. And that contain are 12 modules where we are seeing a lot of people are interested in a functional medicine, learning functional medicine. And of course, I told you more than 2,000 practitioners last 2 years we are trained, and we are seeing a lot of interest, and they want to shift to the functional medicine. And of course, as you said, coaching is a very important part of functional medicine. So we are also teaching how to change the behavior, and you are an expert faculty in a functional medicine in that part. So my passion is to bring functional medicine to the practitioner, so ultimately patient get the benefit. And to support this system, we had started another project, and we are building India's first integrative medicine tertiary center. I will not say the resort, but it's a tertiary center where we have accommodation, and we are building a medical center where we want to bring the Ayurveda, allopathy, and naturopathy. What things that's working in that field. We're going to bring that part, and we want to innovate. We want to innovate, and we want to bring something new to a combination, and we can make some different protocol. So, and also we are working on a very advanced wellness treatment over there. So here we're going to work on a hydrogen therapies, ozone therapies, hyperbaric oxygen therapies, electromedicine is my passion. I told you
Yeah.
from Dr. Jeditan, and I learned the electromedicine, and I'm passionate about how we can use electromedicine to elevate the cellular medicine. So this is somewhat we are building a research center where we can bring functional medicine to a next level, the next
That's
level of advance.
That sounds, I mean, that's the reason I thought I'll ask you, because that sounds really, really exciting. And I think that's the future, honestly, because what you are doing, and that's what's so brilliant about it, you're getting the best of all. All of this is available today, right? I mean, we don't have to now, opt for one or the other. Now we can sort of opt for all of it or whatever is relevant. Honestly, it's up. But at least you're getting the best of all the technology. And by technology, I don't mean only the tech part, the medical part of it in one place. And it's brilliant. And that's actually what is necessary for chronic conditions. For acute conditions, we have that in many different ways, but unfortunately, that was being missing. So I am really excited to see that. I think there's lots happening. I think 2026 is going to be kind of a watershed year. Lots, I know there's lots coming on in the functional medicine space from the IFM. So anything that you want to share, please feel free to share anything else.
Yeah, yeah, yeah. I will tell you some science of how I interested in this integrative medicine. I will tell you. Now, if you look at the naturopathy, they have a hydrocolon therapy.
Okay.
So hydrocolon therapy, they are giving you water enema and their machines, they
Yes.
can clean the large entire colon, and there's a one therapy over there. Now you come to the allopathy, then we says there are gut microbiome and gut infection. Colon is the largest habitat of all the microbiome over there. So science
Mm.
will came then. We have a lot of microbiome testing over there, parasite infection. So we know that colon is very important. And then you go to the Ayurveda, they says ki colon is very important, and they have one treatment called Basti. So they are putting a medicated oil in the rectum,
Wow. Okay.
and we
Yeah.
know that medicated oil, what they want to do, they want to kill the microbiome infections over there.
Mm. Mm.
So we are thinking in collection of all this knowledge we have, and why don't we apply this knowledge? So we can do hydrocolon, we can do Basti, and we can just clean out the colon. Even we can inject the probiotic. What's the problem with that?
Yes. Yes.
Right? So this
Absolutely.
is how, we can make an integration and we can make something that is very helpful to this patient. And this center could be more of research we are inviting, and we are doing a lot of studies over that. We have already started in a functional medicine. People often say is that we don't have evidence, we don't have studies. So in this center, we also want to do publish a lot of scientific studies over there. So
Okay.
that we are started over there because at the end of the day we require some studies and some research going on over here, so we can publish that, and that gives a confidence to our functional medicine community that this is research based science. We're not just talking out of blue, and this is completely a study.
Yeah, so and that will also help to for people to actually take it in, and and for the practitioners to actually accept it
Yeah,
in a
yeah,
in,
yeah,
and it makes sense absolutely. And I love what you just shared, that you are putting in all the therapies which already exist. It's not like
yeah.
something new, right? They have been there,
Yeah.
but you are truly integrating them now. This is what true integrative
This
medicine
is the
is.
operating system. This is the true integration. This is the
This is
functional
a true
medicine operating
integration.
system where you look at the dysfunction and you just apply the functional medicine foundation knowledge, and then you can make a treatment.
And because finally we are not saying one is better than the other, because I think a lot of
Yeah.
times we get stuck there. This is better, that is not, this is not so great. So I think we are just going past that. So let's touch a bit, I think we're almost towards the end, but maybe a couple of questions, that anything that you have seen about the, I know that because you have supplements, and I actually do recommend your supplements and I use some of them. So labs and supplements do get expensive, and you have come out with, supplements. I've used, so I know. But what is your framework for, say, minimum effective testing or minimum effective intervention with the help of supplements? How do you envision this space? Because not everyone can also afford a lot of these things.
Yeah, yeah, yeah. So basically, when I started uh, practicing the functional medicine, initially I bring this nutrition from the USA and European market because Indian, what the OTC or over-the-counter supplements are not effective because I tried that and I seen that I'm not getting a result with that. So initially, I was bringing the supplements from the US, and I thought it's very costlier to bring the supplement from the US market, the customs and pain and time. So I asked myself a question: if I want to do a functional medicine practice, what things I need? And that is came with the nutrition. I need nutrition to prescribe. I cannot give magnesium with the coaching. I cannot give vitamin D within just interviewing and just things. I need at the end of the day nutrition. And if you look at all the science, like if you look at the allopathy, ayurveda, all the science, right, I think the missing part is nutrition. Nobody's really understood the nutrition in a scientific way. All we know is just the superficial science of nutrition, and we consider folic acid, folate, and everything is same. All the magnesium is same, and we prescribe the magnesium carbonate, the Shalcal, or any other brand, all the same. But that is not the nutrition. If you look at the deepest part of the nutritional science, then you will blow your mind. The nutrition is very effective. And giving us just example of magnesium, right? Magnesium, 99% of population they are magnesium deficient. I will tell you a story of my father. My father, right now, he's 78. And when I started functional medicine, And before that, he got to check with a cardiologist, and he found out that he's missing a one pulse after a three pulse. The one missing pulse was there. So we had investigated all angiography and echo and cardiologists, and then they didn't find out anything, and they said it's a benign condition, just live with it. And he doesn't have any kind of symptom except he was a mild hypertensive. And when he checked his pulse, three pulse, after three pulse, one pulse is missing and nothing. So he's lived with that for almost 12 years. But when I started functional medicine, I used to prescribe him magnesium because I had invented the one magnesium over there, and he used to take the magnesium all the day. After 1 year, he had gone to the cardiologist for regular checkup, and cardiologist told, "I don't see any pulse, miss pulse." That was even surprising for me how this happened because I had never invented to give magnesium for this one. But then because I know in magnesium, then I learned that highest amount of magnesium is in the heart,
Mm,
in the cardiac tissues.
mm. Okay.
So
Yeah,
that's a connection.
that's
So
the
that's
connection.
but if you prescribe magnesium that is not bioavailable, not absorbing
Mm,
like a rock, if you take a magnesium rock, nothing will happen.
mm,
So where I learned that iron should be in ionic form. You cannot take iron in a rock form. Like you,
mm,
you take a salt. So if you put a salt in water, what will happen? It will completely dissolve in the water. So
mm,
they're coming in ionic form. The sodium and chloride, they are now ready to react,
mm.
right? Versus you can take a calcium carbonate, doesn't going to create anything. The
Yeah.
calcium will not come out in ionic form. How body can absorb this one?
Mm.
So there are so many things in the nutrition that I started learning, and then I started creating this nutrition. And frankly speaking, I never thought to create this nutrition and giving a practitioner. I actually created for my own self, and I love to innovate. When I look at this one, my core passion is to innovate. That's why I'm here to innovate and integrate and just think beyond what we taught and what we are here. So that's the thought. I came and created the nutrition.
So
White and
that
white
was,
oven.
and that was a supplement. But anything on the labs that you want to share? Anything that you have seen and
Uh,
that are
yeah,
specific?
labs. So another thing I'm observing right now in India. Now, if you look at the whole US education about the functional medicine, there are a lot of advanced functional lab over there,
Yes.
right? But unfortunately, in India, we don't have that kind of advanced lab available right away. We can prescribe. Just giving you example of cholesterol. So we consider that total cholesterol is a only marker for cardiovascular health, but that is not true. Now science came, which is not a total cholesterol, it's a size matter, it's an
Mm,
oxidized LDL matter.
mm.
Even reverse T3 we are not doing in India. Some companies started
Yes.
over there.
Yes.
But apart from this one, there are so many advanced testing. They are right now not in India.
Mm,
So we are still facing a pain to send a sample to US, and
mm.
but eventually we are working on these things, and eventually the lab will come in India, so we can take advantage of this advanced diagnostic. Those who are in conventional medicine, so still waiting for the evidence to come. Although we don't depend on completely on a lab, because with the experience we can say this is a gut dysfunction is there, oxidative stress is there, or we can say hormone dysfunction is there. With even the small whatever the lab we have available, but for this could be another pillar that can help the functional medicine to grow, and that conventional medicine get the doctor get the really evidence of the what is going on in patient's physiology. So I think that's way the functional medicine go one step beyond right now what it is.
So these are all what you're saying. These are all progressing. So
It's a
when you
progressing. It's progressing. There are a lot of labs and a lot of doctors and pathologists. They are right now interested in creating a functional lab. So it is going on.
yeah, so I think there's a lot that's going to come in the, I think in the next
Lot
few
going to
years.
come, lots going to. So I can say those who are right now adapting functional medicine, they are the pioneer. And you see
Mm.
the functional medicine future as growing, and functional medicine could be your mainstream medicine
Yeah, so I
for
mean,
chronic conditions. Yep.
so I
You
think
will find
where,
out. So you'll find out the conventional medicine also started exploring the functional medicine OPDs.
oh,
They are contacted me that many conventional big hospital, they had contacted me. Yes, we want to start a functional medicine OPD in conventional setup. So
uh,
now they are also thinking, functional medicine is a model that we should adopt.
So
So
that's
those
a
who are
kind.
early adopter, they will get the huge benefit of functional medicine when it grows.
No, and and this is what we want. I mean, this is what I think when we started all those years ago, this is what all of us want, that it needs to grow, because then only it can sort of satisfy the needs of so many people who are, who need this today. So that's so heartening to hear. And yeah, so we touched upon lab supplements. I wanted to, touch upon some of these things. And as you said, nutrition is key here. It starts with food, but it can go beyond food, because a lot of times we do need the supplements. We do need a bit more lab testing to dig deeper, actually. Because while we can, as you said, while we can start working with the basics, sometimes we need, we do get stuck, and we need to know what is exactly going on. So that's where functional testing. I just recently came to know, I was doing an interview, came to there's a brand new, not brand new, but there's a new autoimmune array testing which has come. But again, it's not available in India. I think there's 26 markers. I said, okay. So it was very interesting to hear the kind of development that is happening, the progress that is happening. And on that note, you did talk about AI a bit earlier. Do you see that supporting this in some way, whether it's in triage or patient education or adherence or any way? Because we talked about that without replacing the client-patient relationship. We're not talking about replacement here. We're not talking about replacing any coach, medical professional. But do you see that complementing, helping in, and what way? What have you noticed?
Yes, so see, AI will not replace humans and practitioner. That is, I'm definitely sure about that. So we should not fear about the AI, right? We should take advantage of AI. So AI can be our assistant in so many ways. AI can assist me in collecting the information. AI assist me in organizing my information. AI will assisting even in creating timeline. So right now we are working to create and help the practitioner to get the information from the patients and creating a timeline, creating a matrix. Even we had came with the AI interpreting your lab and gives you exactly how the functional medicine model is working over there. And then you take your decision. Why you're wasting your time in organizing, collecting information? Let's AI do that part. And you focus completely on a patient's care.
Mm,
So your focus will be on how I can help in patients, how I can care the patient, not just picking a phone or doing something that is not relevant to patient's care. So all these things AI can do, and AI can help you and help the patient in assisting. So many
mm.
ways AI can help in. You can now future you will see a lot of AI model. They can come, they can interview, they can help you small questions. Even they can help you in arranging the appointments. So it will be a whole ecosystem around the AI. So AI will connect the dots. That's why I told you about, we want to build a team. Like I need a coach, I need a nutritionist, I need an emotional healer, I need Ayurvedic doctor in integrative medicine over here. I need a naturopathic doctor. And then same way, what I need AI as assistant.
Yes, that's true.
So
It's a
that
team.
can that can that can
It's a
connect. It's a
team.
part of team
Yeah,
that can
yeah,
connect all these things,
yes,
right?
yes.
So that way we can save a lot of time and energy of doing on tedious tasks. So AI can help in so many ways.
And it's already actually, every now and then you keep hearing about some in the medical world as well, the medical community as well, not just functional
Yeah,
medicine.
yeah,
It's any
yeah.
everywhere. So I think that's something that we need to look out for. And I was sharing with you before we started recording that I am working on something behind the scene, which I will be revealing next year. When this actually recording goes live, it will be very close to that. But that's something that is exciting, because I'm training AI to listen like a healer. And again, not replacing a coach, but I think, it has the capability, and it can be trained, most importantly, to actually be, help us reflect, people who need to reflect, the emotional healing. So there's a lot that is going on behind the scene, and I'm really excited. I think probably it will be one of the first few product like this. It's not just the AI tool, but it's also the coaching and the community. So yeah, so more on that later. But I think the final question I would like to leave our audience with is your, say, 1 year vision or your 3 year vision. Maybe we'll do a short term and a long term vision kind of a thing. What do you see? Where do you see functional medicine? And maybe if you can share, if we just did three things as a community, functional medicine space, what would help India move the most, in this space? What are those two or three things, do you think?
Yeah. So coming to your first question, definitely world is moving toward a functional medicine. So you can give a different name. You can give a integrative medicine or metabolic health or lifestyle. Ultimately, whatever name you want to give, that's the functional medicine is, right? So world is moving toward a functional medicine. So I can see definitely a bright future for the functional medicine, and we have to adapt a one common system, and that is functional medicine model. Right now, I'm working on this tertiary center. I told you this is the integrative medicine center, and my next vision is to make functional medicine as a research-based medicine, and we're going to publish a lot of studies over there. Many practitioners can come, they can do a training over here, and we can think beyond lifestyle, diet, nutrition, and we can do some kind of advanced therapies where we can do a research on a functional medicine in this way. So next 1 or 2 years, I'm going to build this center, and then I will invite every practitioner over here. They can learn. We can have something in a collaboration. We can work together. And two or three things that I would advise to a practitioner community. And same way, my expectation from the community is let's come together. It's not a one-man job. It's not a one community jobs. We have to open our mind. Let's collaborate and don't do functional medicine practice alone. It's at the end of the day, it's a collaboration. So let's bring this functional medicine to a next level, then come out of your comfort zone, I can say. Whatever practice you are doing, you have to come out of your comfort zone and jump and learn the functional medicine. And when you collaborate, when you connected with the likely minded people, the energy will blast, and that functional medicine come in a picture. Many patients are actually looking for the functional medicine, doctors and practitioners. So let's be a part of that movement, and let's involve in growing the functional medicine, I can say.
And that's such a powerful statement to close on, and such a positive statement to also message for because this I think conversation will help practitioners. It will also help patients who are looking for this opportunity to work with a functional medicine practitioner, and also for practitioners and coaches who are looking to get into the functional medicine. And as you said, in brief, a rising tide lifts all boats. That's what we are. I have been been in isolation so far for different reasons, but I think I know that you are one of the people who sort of pointed it out, like can't do with doing this alone. You need to be doing this in a as a team, and whatever the team might look at. So that's helped me personally, so thank you for that. And yes, anything that I haven't asked you that I could have asked you, anything that you would like to share,
No, I think
anything.
we are discussing in Broadway all all the
We've
part of
covered
functional
everything.
medicine model. Yeah, functional medicine model, and I'm just having a passion to bring the functional medicine to whatever the corner I can bring, and whatever way as we are sharing the same thing, how we can contribute, how we can help other people and other practitioner. And right now I'm focusing how I can help practitioner to bring the functional medicine to their clinic. And this is going to happen. This believe me, this is going to happen in a near future.
Yes, I completely believe that. And we are on the same page. Yeah, we've all been on the same page for a long
Yeah,
time. And I'm just
yeah.
glad that I brought you on today. So thank you once again for being on this show. It was a wonderful conversation. And as I said, it's going to help a lot of practitioners as well as a lot of patients who are looking for this kind of approach, and they'll get some clarity on this. And I will share the Vita One link. I will share the Instagram, and the social handles in the show notes. But where would they actually find you? On the website? Was that the correct place to look for you if somebody wants to get in touch with you?
Yeah, so they can just look at the vitaone.in, and those who are practitioner, they can look at the Vita One education, and they can find out me over there.
Okay, perfect.
Yep.
Thank you so much. Thanks a lot.
Thank you. Thank you, Nidha. Take care. Bye bye.